Fellas, you know Degree Cool Rush deodorant, right? Well, last year they changed the formula, and guys were mad about it. One dude even started a petition. So guess what? Degree heard us, admitted they messed up, and brought the original Cool Rush scent back exactly how it was. And it's in Walmart, Target, and other stores now for under $4. So grab some and remember why its cool, crisp, and fresh scent made it the #1 men's antiperspirant for the last decade. Degree Cool Rush is back, and it smells like victory for all of us.
The last thing you want to hear when you need your auto insurance most is a robot with countless irrelevant menu options. Which is why with USAA Auto Insurance, you'll get great service that is easy and reliable, all at the touch of a button. Get a quote today. Restrictions apply.
USAA. The Dental Download podcast is your source for insight from conversations with fellow dentists, specialists, and leaders in the industry. With new episodes every Monday morning, I'm your host, Dr. Haley. Let's get into this week's episode. All right. Hi, everyone. We have a really exciting guest here today. Would you be able to introduce yourself a little bit and tell us about your background in dentistry?
Of course. I'm Dr. Ashley Ciapciak, and I am a general dentist practicing outside of Boston. I've been in practice and owning my practice for about 5 years now. I also run my TikTok page at Dr. Ciapciak. It's hard to spell, so if you just write at DRC, I should come up. And yeah, I've been practicing out in the world for about 5 years.
Awesome. I'm excited to talk about your journey as a practice owner and a little bit about what kind of got you into TikTok and how it's been going. But another thing that you're involved in that you didn't mention in the intro is working at BU. So tell us a little bit more about that.
Yeah, so I started teaching part-time at Boston University Dental School a little under a year ago. I have always been interested in teaching and reached out to them just to see if they had a role available. And they reached out a few months later and said, yeah, we actually do. We're looking for clinical instructors to basically help our students work through each procedure that they do in their dental clinic, 3rd and 4th years of school. And they hired me on for 2 days a week. So I cut 1 day a week out of my office. Now I'm in my private practice Monday, Tuesday, Wednesday. I'm at BU Thursday, Friday. And very soon after hiring me, they also promoted me to course directing dental anatomy, which has been a really fun journey. So now I'm lecturing on Fridays with first year students and just having a blast. It's a totally different dental atmosphere and totally different way to flex my dental brain muscles, if you know what I mean. And I've had a great time in my time there so far.
So did that interest in teaching develop back when you yourself were a dental student, or what made you decide to reach out to them and send that email to see if they were hiring?
Good question. I was voted my 4th year by my classmates as most likely to return to BU and teach. That was my graduation superlative in my yearbook. And I think that superlative came from very early in my dental school education time at school. I guess during my first year there, I started making study guides for myself to study off of. And my my dental experience was very collaborative. My class really wanted to help each other succeed. I'd argue there was no gunners or no traditional person or individuals that wanted to, get ahead and be better than everyone else. My class really wanted everyone to succeed and do well. So because of that nature of the school at BU, but also of my specific class, I found myself making study guides and then just sharing them, and people liked them. And then I started making more. I started honing the skill and color coding them a unique way. And kind of all throughout my 4 years there, I became known as the person who makes the study guides. People started expecting them. People started joking I should charge for them. I never did. I always thought that was wrong, but I always loved the collaborative nature of an education setting. I loved the back and forth between students kind of while I was there. And I missed a piece of that when I was in private practice, working with just one other individual. I work with my dad. I took over his practice. He's been my associate for like 4.5, 5 years now, which is an interesting dynamic. But I miss the collaborative nature of being in a room with multiple dentists with multiple different opinions, and the energy that schools and students bring. I just think is a very unique thing. So kind of all of that put together made me always in the back of my head think I was interested in this and interested in education. And kind of randomly was like, hey, maybe they'd take me. I'm 4 years out. Maybe I've got enough experience to try my hand at this. And they did. And it's been a really fun journey.
That's amazing. And I mean, I have a couple things to unpack from that. One, you're working 5 days now. That's probably a lot, probably draining. Also, I love that you mentioned just you've always been really passionate about education and collaboration, because even as looking to become a dentist, the patient education component and kind of the relationship building, all of that really interested me in dentistry. So that's another kind of cool element that we get to do every day clinically. But it's interesting how you mentioned the difference of what you get with collaborating with dental students and other dentists at the university setting compared to educating patients is totally different. So that's cool. But how is the 5 day a week thing going?
So that was a transition, only because I'm an avid snowboarder in my free time. So winters are like really tight on time for me. I am never home any weekend in the winter. If there's snow on the ground to ski, I will be out there skiing. And so my hours at BU, I added a Friday, and I had not worked Fridays since I had graduated. So I had been very used to skiing on Fridays, and I was like, I'm giving that up. That's a big step for me. I've gotten very quickly used to it. Their hours are based, their clinical hours are very much based on when students are seeing patients, and they see patients in a 3-hour block in the morning and a 3-hour block in the afternoon. And then there's a 3-hour evening session, they call it. So it's 4 to 7 o'clock at night. I don't work that one. When I talked to my husband about taking a day or two at BU, he was like, hey, I'd like you home for dinner if that's at all possible. And BU and my boss and kind of team there were just incredibly gracious with letting me kind of choose my time that I could come. And so I work 8:30 to 3:30, gives me afternoons off, kind of gives me a little bit of that flexibility, but it was a transition. It's a different realm. So I'm not cutting teeth there when I'm at the dental school versus I'm doing wet dentistry 3 days a week in my private practice. And I work about 30 hours on the front end of the week doing physically wet dentistry. But observing the dental students, it's more of flexing my brain muscles of how can I word this in a way that the student will understand and it will translate into that student's hands. And that's a very different muscle, different thought process, I think. So that's what keeps it fresh, keeps it interesting, but also doesn't tire me out, I think, as quite as much.
Gotcha. And I remember back, I was just in school a year ago at this point, I was finishing up. And a lot of our faculty that worked in the clinic and also in practice said for them, the way it worked at Michigan, it was basically like they were volunteering. Like they got paid a little bit. They still had to pay for their parking when they were there. And they were kind of just there out of giving back to the student learners. Like it was definitely financially not worth it. It was just something they wanted to do. Obviously, don't need to get into the nitty gritty, but in your situation, is it something that is additional significant income, or is it more because you're passionate about teaching?
A little bit of both. So in my private practice, I'm paid by, commission. Basically, I'm paid by what procedures am I doing, and I can crank that up or tone that down depending on what the patient needs, right? I'm going to either get, a few $100 for a filling, or I'm going to get a few $1,000s for a crown. Whatever is going on for that patient will totally depend and base my salary on whatever my needs are of my patients, basically. At BU, it's a daily rate, at least when you start out. You start at kind of a everyday salary per day. And I'd say it's very competitive for the New England area. So I don't feel like it's a big pay cut. That said, it is not as competitive as owning a private practice salary would be. So there is a little bit of kind of knowing that, going into that, knowing that you're choosing a daily rate versus something that you could flex up or down, based on what you're producing. So I think that might be school specific. I know in my area, just in Boston in general, cost of living is high. I know that BU as a dental school is very competitive, and they want the best of the best. And they, in my opinion, fight financially to keep the best of the best. So I don't feel that way. I do think the other big benefit to it that people don't talk about enough is if you're full time in a school setting and you're teaching full time and you stay for 10 years, you can get loan reimbursement. So you can actually not pay dental school loans ever. You have to apply for the reimbursement, but a lot of faculty do that as well. A lot of younger, newer faculty choose to do that for loan reimbursement reasons, which is nice.
That is a really good benefit for people to consider. Another thing I'm curious about, if you're considered full-time with the dental school, do you also get benefits like health insurance and things that most
Yeah.
practicing dentists kind of have to get privately?
Great question, because you're exactly right. Most, practice owners, I have to pay for my own stuff. I actually use my husband's insurance. So that's, how I work around that. But yes, you would have to buy everything yourself in your private practice. At BU, they offer us full benefits. We get all sorts of, even maternity leave. I think it's at least multiple months. I don't know how many months, but I just had a friend go on maternity leave. I think it's like 4, maybe 6 months of maternity leave paid. That's amazing. You can't get that in private practice. So that's a huge benefit. Time off, they'll give us time off for vacation, paid time off, of course, but then they also give CE time off because they really want to incentivize you taking courses. So actually next week I'm taking 4 days in California to do an implant pathways kind of CE weekend. And then about a month after that, I'm going to do live patient CEs with that same group for placing dental implants. And all of that was approved, and BU was like, no problem, we want you learning. So I think there's a lot of really great benefits that people just don't talk about as much.
Oh, that's cool. I just did implant pathways session 1 through 3 a couple weeks ago at the end of March. So,
I love that. Okay.
yeah,
Yeah.
same program. Last
Just missed
question.
each other.
I know. I think I even saw you commented on one of like the lectures about it. I was like, oh my gosh, I know her from social media. That's so fun.
I love that.
But last question about kind of the dental school life, and then we'll get more into your work kind of clinically in your practice. But I'm sure interacting with the students brings back a lot of memories from your days as a student and kind of trying to see, like you said, how can I make this make sense to them? How can I connect with them, relate this in a way that's going to work well for them? But looking back at dental school, what are kind of some of the harder times that you remember for people listening in that are maybe still in dental school? What were some of those harder moments and how did you work through it?
I talk about a lot of this openly on my page because I think burnout and anxiety and the pressures of dental school they kind of get brushed under the rug. I learned my third year of dental school specifically that I have anxiety. I didn't know what I was going through, but I was taking courses every single day. I was trying to manage patient load and scheduling patients on top of all my exams. And back when I was there, which wasn't long ago, but when I was there, our clinical boards were split into 2 different years. So between our 3rd and 4th year, we still had a written board, and then we had more live patient boards. And the stressors of specifically my 3rd year of dental school and the transition into clinic was so brutal for me that every single morning I would wake up from my bed, go to the bathroom, and throw up. Couldn't figure out why I was doing that. So I talked to a lot of doctors. They checked me, scoped me. There's nothing wrong with my stomach. They couldn't figure it out. And then one of them recommended that I see a specialist and talk about anxiety. And I thought it was one of those things that they were just gaslighting me. Oh, you're just anxious. And I was like, there's something wrong with my stomach. She was right. She taught me breathing techniques, taught me how to calm down, taught me how to prepare and how to sleep better at night and how to basically not hold everything in because I was holding everything in and then just would come out as throwing up every single morning for months. This went on for months. And I remember that often when I'm teaching because I don't ever want to be the faculty that causes somebody to feel that way. Not that my faculty were causing that. I think I put it fully upon myself, but there's instances in clinic. There's ways to phrase things that we can phrase things to students in a way that will make them feel lesser than, or there's a way that we can phrase it to build them up and educate them and make them proud of something or learn from something, even if there's an error in that to learn from. And I've really tried to hone that skill and practice that skill. I'm sure I'll get my feedback from my students at the end of the year. They do reviews on all of us, and I'm sure I'll learn if that's working or not and try to hone that skill differently if I am bringing anybody any sort of anxiety. But I talk openly about that with my students because school brings a lot of stress and live patient care brings a lot of stress. And I try to always show them, tell them, remind them I've been there. I was not there that long ago. I'm here. Lean on me. Please use me for support. Let's talk about it. Let's hash it out. What went wrong? Are you okay? And I think remembering how I was struggling through dental school with my anxiety helps me try to manage that for my students and their patients.
Wow, thank you for sharing that too here. And I think I've seen some of your videos kind of going into the hard parts of school. So it makes a big difference. I try to do that too, sharing just it's not always perfect. And I think it makes people feel less alone for sure, just hearing other people go through tough times too. But, we find ways to work through it just like you did by getting help and now being in a better place. So that's great. Here's a question I probably asked myself a zillion times as a dental student. What comes next after graduation? You too? Well, here's some good news. ADEC is putting together a special event to help answer that question. A free Day of Experts that's focused on bridging the gap between dental school and real-world success. You'll hear from experts who will teach you the important stuff you don't learn in dental school, like how to finance your dream office, how to market and grow your practice, and how to avoid expensive mistakes along the way. ADEC's Day of Experts is free to dental students. They'll even cover your hotel, meals, and drinks. All you have to do is choose a session, June 13th in Nashville, Tennessee, or July 25th in Newberg, Oregon. See the link in my show notes to register for ADEC's Day of Experts now. You've got nothing to lose except worrying about what comes next after graduation. As you're now working as a dentist, what have been some of the best parts being out of school, being able to work, kind of control your own schedule? What have been some of the highlights?
I think honestly, the biggest highlight is my team, the team that I work with, the team that I've hired. My dental assistant specifically always deserves every shout out that I could ever give him. He's just an angel and is just the best gift to my office. But the team that I've created and the vibe and the culture of our practice is welcoming. It's kind. It's fun. We do a lot of different types of dentistry, high level, high skill stuff. We were just talking about implants. I also do root canals. I do stuff that things very quickly can go wrong and things can get stressful really fast. I've worked really hard in the last 4 years to build our team culture. And I think that's returning to that every day that I'm in my private practice just reinforces all that hard work worked and everyone gets along. There's really no drama, which is crazy. That doesn't exist in dental offices. So there's very little, no drama. Everyone's very open with each other and communicates very openly, very efficiently. They're tight on medical emergency training, which is also another thing that a lot of offices struggle with. I'm just really proud to work with the people that I work with. I handpicked most of them and I hand trained most of them. And I can't wait to kind of spend the next many decades of my career with them, hopefully.
Gotcha. So when you had, because we're kind of going to talk about the transition with you getting into practice ownership, kind of taking over from your dad. So it seems like at that transition point, you brought on new staff, different staff. Did some of the old staff retire as your dad kind of switched roles, or what was the transition like?
Yeah, transition was rough for about 2 years. So I took over, I graduated during COVID. So we were actually shut down for about 4 months or 3.5 months or something. Massachusetts was just no dentists unless it's a true dental emergency. Some offices stayed open and kind of argued that their fillings were emergencies. We were pretty tight with the rules. So we had everybody stay at home basically for several months. And during that time, I became licensed. I took over. I now owned it, and it was kind of a weird transition. So upon return, I had a lot of staff meetings with the very few staff that we had because he was a single clinician, one dentist. We had 2 hygienists, and then we had 1 assistant and 1 front office person. And all of those personnel were very kind of open and honest with us. We had a lot of meetings about how do we navigate this new world and how do we go back. And during that time, we were also looking to expand because 2 dentists, you need more operatories. You just need more space. We had 4 operatories, but it was tight. So we moved and we built out a whole new office. We now have 8 operatories. To fill that, I needed more hygiene. I needed more patients. I needed more team to kind of build the workflow. We did lose one hygienist just to COVID choices. She was not interested any longer in working in the field of hygiene because we're very close to people, and she had her own medical concerns, and she's like, hey, this just isn't for me anymore. I don't want to deal with the risk. So for that reason, we did lose one team member, and I hired two more who've been outstanding. So now I've got 3 hygienists on our team. I added another front office team member, and I added my dental assistant who found me on TikTok, I think. And we interviewed and clicked like right away. He's a Virgo, I'm a Capricorn. If you know, you know, we are tight, like really, really close. So the expansion kind of happened naturally. We pushed, not ad campaigns, but SEO on our website to get more traction on Google, and kind of filled our bays and filled our rooms. And now we're consistently functioning out of about 7 operatories, still waiting to fill the 8th, but looking towards Dr. Breedy, my dad's retirement in the next year or so. I'll add another dentist. We'll see how that goes. Maybe I add another after that. But it was a very smooth adding people. People accepted me because I had been a dental assistant at my dad's practice back as early as age 13. So everyone in the practice knew who I was. They knew me. Took them some time to learn that I'm not Ashley, that I'm Dr. Ciapciak at work. That was kind of funny. But everyone took it really well because we listened to them during a very crucial, difficult time in the world. And I kind of allowed them to dictate how they felt comfortable coming back and how we could make that a smooth transition.
Yeah, that's a good point you added at the end there, that trust can build a lot of respect going into the transition, and making sure that you were putting them first and showed that they were valued, I'm sure really meant a lot to them and carried well into getting back into the swing of working and everything. I'm curious, otherwise though, I mean, a lot of people probably have misconceptions that like taking over for a family member is just like, oh, you walk in, now you're just the boss, and like it's just easy breezy. I'm sure it was not like that, especially with everything you just described, that it's almost like you started up a new office. You just had a subsect patient base, subsect team, but you expanded so much that, I mean, it's almost like someone doing a startup.
So you're almost exactly right. There is still, to this day, I've been there for 5 years, there's still maybe 20, 30 patients that will not see me. They won't let me do their exams. They're choosing to continue with Dr. Breedy. I'm not sure if I'll see them when he retires, right? That's their choice. That's their relationship with their dentist, and I respect that. So there was some tricky parts. Me and my dad practiced dentistry a little bit differently. He's almost 70 now. He still uses porcelain fused to metal. I only use it if I absolutely have to. He'll still take infragum impressions for every crown. I scan 99.9% of my crowns. We just work a little bit differently. He doesn't do clear liners. I'm Invisalign certified. So I tried to learn his strengths, learn my strengths, learn his weaknesses, and learn my weaknesses, and try to play to both of our strengths and schedule accordingly. So I'd say probably 80-90% of my patients will actually see us both. We go back and forth depending on procedure. There's just some things that he might do better. For example, I hate, personally, this is a personal take, I really hate molar endo. Don't like it. Never perfected it. It's just not for me. So I refer that to Dr. Breedy, who does really excellent root canals. Why would I touch that if he's going to do an excellent job? You can go ahead and have fun with all the instruments that you're going to play with for the next hour. I would have a miserable time. So we kind of play that back and forth a little bit to my patient's success. There's definitely some preferences. One of our hygienists who's been working with us for decades is very familiar with how Dr. Breedy treatment plans. He usually does her exams just because they just vibe, and it just is. So we try to play to those strengths, but it's difficult. His expectations on me are harder than I would argue they would be for someone who's not family. And there is a lot of expectation that this was easy. And you're exactly right. Gaining trust and proving yourself as a woman, as a young clinician, is always going to be difficult, regardless of if you're related to the person or not. So you're exactly right.
And it seems like you, over the years, have a pretty good handle on your practice management and your leadership skills, team development. I'm sure all of that took time to build. Was that something that your dad coached you on? Did you do CE for practice management stuff? Did you work with a coaching program? How did you go about it?
Yeah, great question. He's actually a lot more hands-off than I am. I'm a lot more hands-on. I've been in a lot of leadership positions in my sorority, and I used to be a competitive cheerleader. So just in different parts of my life. I took some classes with Spear. Spear is an online education platform that's really great for just general knowledge stuff. To hone that skill, I've read a lot of books on leadership and on guiding folks and not micromanaging, kind of different, how to navigate difficult tasks and difficult conversations. And that's been really helpful, but a lot of it learning by experience, learning by feedback. I'm big on, if I'm doing something wrong, please tell me. My team knows that, so they will call me out and they will speak to me about it, and we will try to navigate and fix that, because hard feelings are going to stay hard feelings unless we talk it through. So I feel like I'm very approachable in that way, but a lot of trial and error. There's a lot of great podcasts, a lot of great books, but Spear Education also has some good CE classes on it.
And another thing we talked about a little bit earlier, we mentioned like how maternity leave works at BU, and you just mentioned a little bit about that it can be tough to win the trust of some people as a woman in dentistry, as a young person in dentistry. So have you faced many challenges with being a woman in dentistry?
I think everyone's going to answer that question yes. I didn't expect to. I'm in New England. I live and work in Massachusetts. I'd argue that this is one of the most welcoming communities to women, to people that look different, the people that speak different, people that make different choices, than some other parts of our country. But I've got some pushback. I've had patients directly tell me, I won't work with you because you're a woman. I did some of my training in a federal prison. I worked as a dentist in a federal medical prison. And specifically, I had folks who were incarcerated because of terrorism acts against the United States. And none of them, not one single person who was incarcerated because of terrorism would see me because I was a woman. So I've definitely dealt with that. I've navigated that. I just step away. I truly believe if they don't want to see me, then see who you'd like to see who you're comfortable with. I think that trust goes two ways. And if you don't trust me, it's going to be a bad experience for both of us anyways. So I choose to just step away. And if they choose to, move on to another practice, then that's your prerogative. That's your choice. And I think it's a free country. So I let them make those choices. But it does hurt. It's a little sad for sure.
Yeah, definitely. When did you work at the federal prison experience starting with your dad right in COVID after graduating? When did that fit in?
It was an externship. So it was right, I guess a year before I graduated, we did 10-week externships at BU, and I was placed, and I was so excited. It was a great experience, but I was in Federal Medical Center Devens, which is one of the 6 federal medical prisons in our country. And I was the dentist there for 10 weeks with 2 kind of supervising dentists. Mostly we did a lot of extractions, a lot of really big fillings, but that training, that job, understanding the federal regulations on dentists and what types of care they can provide, actually weirdly later in my career gave me another side gig that I've now worked the past 3 years overseeing dental care as a care monitor of some county jails outside of San Francisco, out in California. There were some dentists that were part of a big lawsuit against a jail system for basically performing less suboptimal care, I guess, medically. The dentists just got roped in because they had to, and it's just part of the lawsuit, I guess. The dentists were doing a good job, in my opinion, but for the past 3 years, it's been my role because I had that training in the federal prison system. They hired me on as the kind of outside expert to look at the cases and spot check all their work and give the courts a thumbs up that the dentists are doing what they should be doing, and they very much are. Their patients are being seen and all that good stuff. So you never know where life is going to bring you. That's been a great job. 2 at least 2 trips a year I'll do out to California to do site visits for them, and I review cases and charts. It's winding down now because everyone's in compliance, which is really excellent for the incarcerated folks, but you just never know where your dental life will bring you.
That's interesting. So is that something that, like, how many hours a month are you working on that? Or do they just kind of come to you when they need something reviewed?
Kind of both. I want to say in its early age, kind of early era of it, about 3 years ago, I was probably reviewing maybe 8 to 10 hours of charts per month, maybe. I'd review about 8 to 10 hours of charts every month for about 6 months. And then I'd present all my findings to the courts and to the medical monitor and to the lawyers involved and all that stuff. The good thing about my role was that the dentists were very understanding, and actually, because I was involved, I was able to get them a digital x-ray sensor, a pano machine. Basically, the government was like, "Ooh, we want to make sure that they're set up for success, and there's these people watching now, so let's put money here and fund them." Once they were funded, I got them another dental assistant, just because I was involved. They were able to quickly, successfully improve, and I had very little work. Most of my work was just me giving them thumbs up because they were doing an excellent job. The medical monitor definitely had a little bit more of a role because there were so many MDs involved and so many physicians, and so many different needs of the incarcerated folks out there. But it kind of wound down to maybe 4 hours or so a month, and I'd present the same findings. And then now we're kind of winding down. The justice system was happy with the amount of compliance they've seen consistently over the past, I guess, year and a half or so. So we're almost off the job, which is great.
That's very interesting. And I remember you've talked a little bit about it on one of your TikToks too, I think. I've watched most of yours. But another thing you've talked about is other times you've gotten to collaborate with brands, kind of being a dental expert for them to give your input. So do most of those opportunities, are they reaching out to you? Are they finding you through TikTok? How are you getting in contact with these companies?
It definitely varies company to company. There's a platform called Acorn that a lot of people, I guess, people who are making TikToks, Instagrams, YouTube, or whatever, can go on Acorn and can request jobs. So that's like normal ad placement stuff. I actually didn't know about that until a week ago when I was asked by Colgate to use the Acorn platform. I was like, "Oh, what's this? Oh, is this how everyone's getting brand deals?" Okay, I'm oblivious. So I've worked with Pronamel, I've worked with Colgate, I've worked with Crest, I've worked product development with Crest. I've worked kind of ad campaigns with Pronamel and ad campaigns with Colgate. And then I've worked behind the scenes with Dandy, which is a digital dental lab, on kind of beta testing clear aligners, beta testing their layout, all behind the scenes stuff that I don't really talk about. But I am going to do some collab work with them, I think, coming up. We're trying to negotiate that. But it's been a little bit of both. They've DM'd me, they've emailed my office if they're interested. And I'll email back if it sounds like something I'm capable of doing or something that I think I'd have fun with. I don't know. I think they've mostly found me on TikTok, though.
That's awesome. And I've been following you on TikTok for years now. When we messaged to set this up, I realized I'd messaged you like multiple years ago. And I can't believe like TikTok's even been around multiple years. It's just like crazy to me. So what made you start posting on TikTok, and kind of what keeps you going? Because I know there's a lot of, sometimes there's drama, sometimes there's different things. So what keeps you going? What got you started?
I started TikTok because I was a little bit bored. My office, my work was slow because it was still COVID times. It was early 2020 or like mid 2020 when I started my TikTok. And I was like, well, people are sitting at home, they're on this new app, and maybe I can educate them on things that I love. And I truly love talking about dentistry. And I think there's just so much knowledge to share. And I was seeing other creators that I followed. I was learning a lot from other creators. Lady Spine Doc, for example. I knew nothing about neurosurgery, spine surgery, until I started following her content. And I just love learning. So I thought it'd be cool to have a dentist on there. Now there's a bunch of dentists on there, and I learn stuff from them almost every day. So I thought I'd add my 2 cents. I started it in 2020, I think summer or fall of 2020, I just want to educate kind of share some knowledge. And now it's become a little bit of a side job for sure. I definitely feel a little bit of pressure to keep content up. I try to ignore that pressure because I really only want to post authentic content that I'm interested in and I think people would be interested in. I can't post every day. I'm too busy. It's just never going to happen. But I keep posting because there's things that come up in everyday dentistry that I think either a patient would benefit from, a pre-dental student might benefit from this knowledge or information, a dental student might benefit. So I try to curate my content to different audiences a little bit. Not every dental, professional who follows me is going to like every piece of content that I post, but I always post things that are supported by literature. And if I have someone questioning that, I always post a deep dive in the literature so we can review it together, just to share knowledge. I just think it's really important to collaborate as a country, as a community, anywhere from pre-dentals to patients to you, to other students and other clinicians.
That's awesome. Yeah, I mean, your content's great. I admire, as you said, you really try to back up everything with literature and you're not afraid to kind of poke your head in and say, hey, actually, this might not be the best way to do something. So I get a little chuckle out of it, but I also think it's awesome every time I see you pop up and a comment or stitch something and put your 2 cents in, because we need people to, keep the dialogue going out there.
There's a lot of really bad PPE, personal protective equipment, on TikTok. That's like what sends me. And I'm like, I'm just going to comment. Okay, I'll start some tea because we can all learn how to put our masks on, how to put our goggles on that should be above your nose. Like, we all know this. So it's an easy thing. With the fake veneer text, that was a crazy trend. Yeah. They're still on my page. So I try to call those out when I find them.
They're still out there doing things for sure. So a couple more questions before we wrap up here. You kind of already mentioned one of your passions is skiing in the winter. You're super busy trying to maximize any time you're not at work with trips for that. But you're pretty busy. You mentioned you're married. How do you kind of schedule out your life, personal life, travel, practice, CE? What is kind of your secret to it all?
There is no secret. I do actually schedule absolutely everything from rest time to when I'm reading to when I'm knitting. My brother just had a baby and I'm so excited to meet him, but I need to knit his baby blanket. I need to finish it, right? So I schedule that in my phone and I try really hard to keep to that schedule. I try to put personal blocks for rest. I try to only go on a bigger trip maybe once a month. Like, I'm going to a CE class this month. Let's not do something the next few weekends. The month after that, I have another CE class, but I try to space things out a little bit. I think I'm a bad person to ask for balance. I fill my life to the absolute brim and I have no regrets for it. I truly try to fill every single day. My therapist thinks I need to learn how to relax. I haven't learned yet. So when I learn, I'll let you know.
I get that. I hear that from a lot of dental students. And I used to be probably all the way to that level at the beginning of dental school, and I kind of scaled back a little bit. But I mean,
teach me.
Hey, I mean, you're very successful, and if you're feeling good, like, that's all that matters. Is like, if you wake up every day and you're like, all right, I like what's on my calendar, then I think you're doing life well.
That's fair. I'll take that as a win. I'll tell my therapist you said that.
When did you start doing CE out of school? And I mean, for a lot of people, it seems like a big investment for some of these courses. Like, what advice would you have for new grads in regards to continuing education?
If you can sign up for a study club in your area, sign up for a study club in your area. I think that what that means, what that is, at least in my area, is specialists, other general dentists. We have, for example, in my study club, I've got a periodontist, 2 orthodontists, an endodontist, 1 endodontist, and like 6 GPs, 6 general dentists. And we all present cases. We show x-rays, we show photos, we show things that we're struggling with. We talk about the nuances of running a business, hiring someone. What are you guys paying your assistant? What are you paying for, your repair technician to come in and repair your chair? So there's a constant kind of text thread coming from my study club also of cases. And I'm dealing with this right now. Do you guys have a take on this? What's this pathology? So join a study club. I joined through Spear. Spear is an online education platform. It's like $100 or 100 something a month. And I think that's a hugely good investment. Very early in my out of school time, I started taking classes in things that I thought I wasn't as strong in. For example, I was only able to restore one implant in dental school. Just my time got cut a little short. I could only restore one implant. So I didn't feel super confident with a real patient in the real world restoring a single unit tooth implant. So I took a bunch of classes in it. Implant overdentures, took a bunch of classes. Erosion and abrasion and fraction. What are the differences? I took a bunch of classes. So they've got a lot of online CEs. I found that super easy to navigate, but they also have local study clubs. And that gave me a lot of local mentorship and a lot of really great people to refer to, because I see them present their cases. I see them show us, here's where I struggled. Here's where it went wrong. Here's where it got better, because I knew how to manage this. This is how I managed that complication. And seeing them work through that helps me work through a lot of that. So I think those are two huge things: to just hit the ground running, keep learning as much as you can, consume as much volume as you can. And if you want to do it passively, follow other dentists, follow denture technicians, follow lab technicians. Those are all going to show you how the behind the scenes things are working when you're passively just scrolling on your phone. And you can learn by passively just scrolling on your phone. So never stop learning. Don't think you know everything coming out of dental school, because we do not. And the second I think I know everything, please remove me from this profession, because there's so much to learn. I think just keep learning.
Hilton brings you new ways to stay, with experiences that let you capture the glory days. Introducing the Graduate Hotels. Each inspired by local college towns, these stays are always original and never boring. Get in touch with traditions all across the country and enjoy a stay that's a class above the rest. Book at Graduate Hotels with Hilton Honors Points at Hilton.com. It's a win-win. Hilton, for the stay.
This episode is brought to you by Indeed. When your computer breaks, you don't wait for it to magically start working again. You fix the problem. So why wait to hire the people your company desperately needs? Use Indeed's sponsored jobs to hire top talent fast. And even better, you only pay for results. There's no need to wait. Speed up your hiring with a $75 sponsored job credit at Indeed.com/podcast. Terms and conditions apply.
I lost you for a second there. That's why I was delayed in responding.
Okay.
Last little bit, you mentioned that you learned a lot as well for leadership through books. Do you have any book recommendations for people listening in?
Look up the name of it. I just bought it. I love it, but I forget his name, and I just gave away my last book. Okay, Breathe by James Nestor is a super good book to learn about airway stuff. And Dr. Ollie on TikTok has a book that he just came out with that's about how to navigate, and I forget its name, I'm trying to look it up right now, but about how to navigate difficult conversations with patients and difficult things that you're going to encounter, whether you're overscheduled, whether you're dealing with, somebody who's asking you to do a procedure that you don't feel comfortable doing or you don't think is right for that patient. He talks about how to navigate that, and I think that's a super helpful book, especially for new grads. I think those two.
Yeah, it was funny. I was just at a breathwork class last night that one of our hygienists was doing in our town, because she is a myofunctional therapist as well. So she was putting on this class for people in our town, and she was telling everyone to read the book Breathe too. So
it'll change your whole perspective on absolutely everything. It's a great read.
I'm sure people will want to check it out now. But before we wrap up, last final thing, I'd just like to give people a chance for some closing thoughts, any last advice to leave with people listening in.
I think as newer dentists, as female dentists, trust yourself, know what you know, and know your limits of your knowledge. If you don't know something, step away, learn it, study it before you work with that patient or continue the care. Lean on your resources. There's a lot of dentists out there that really want to help each other. And if you haven't found a mentor yet, we're out there. We exist. They might be in a study club. That mentor might be a faculty that you really liked working with in dental school. That mentor might be on TikTok. You just don't know who you'll meet and who you'll connect with. And keep asking questions, keep learning. And I think all of us have the opportunity to be really excellent dentists someday. Every day is a new day to keep learning and growing.
Well, thank you so much for your time tonight. I sincerely appreciate it. And I know people will leave feeling more inspired towards their goals. So thank you again.
Thank you for having me, and have a great evening.